Cancer has surpassed heart disease as the leading cause of death for many high-income countries like France, Italy, and the UK, according to a recent study published in the journal Lancet. Joining us now to discuss is IMA Senior Fellow and expert in functional and integrative medicine, specializing in innovative approaches to cancer pre-screening, Dr. J.P. Saleeby. Good morning to you, sir. Thanks for joining us here.
Good morning, Jan.
You know, one of the reasons for this increase I was reading is because high-income countries do tend to have, of course, older populations, and of course, cancer is more common with age. Also, cancer screenings can be confusing and even intimidating for many people. So what's the single most important thing you wish every person understood about cancer screenings?
Well, it's kind of complicated, and it's very personalized, and there's a lot of precision medicine involved. So in my practice, I spend an exorbitant amount of time educating the patient. So it's not a one-size-fits-all cookie-cutter process, as mainstream medicine tends to do so with like mammography, colonoscopy. So I think the most important thing to realize is why you want to do it and how you want to do it. And you'll need to know the pros and cons. So the pros would be early detection, less aggressive treatment, improved prognosis, and a peace of mind.
How do you take...
Sure.
I just very quickly, how do you tailor cancer screening recommendations for patients who might be high risk but want to avoid unnecessary radiation or invasive procedures?
Right, so it could be, again, very personalized. You do a very good history and physical exam, you do an inventory of social and family history, and then you use select biomarkers like vitamin D levels, homocysteine levels. You look at certain biomarkers of inflammation. This will all raise the risk of certain cancers. So that's a starting point.
When you talk about vitamin D, this is very important. I think this is interesting. So have you seen a correlation between low levels of vitamin D and more incidences of cancer?
Yes, more incidences of bad outcomes with infectious disease, more incidences of autoimmune disease, and yes, cancer. So vitamin D augmentation is one of the standard processes of cancer therapies in the alternative realm.
Interesting. And why is that? And what's the best way to get vitamin D, do you think?
Well, you know, sun exposure is one way, and then supplementation with vitamin D3, K2, for example, from a very good supplement company is the other way.
When it comes to breast cancer, mammograms, as we know, have long been the standard there, but they don't come without their downsides. So what are the drawbacks of mammograms, and are ultrasounds or MRIs better, do you think?
Yeah, so mammograms have been sort of the standard of care. That's the narrative. Women should get it every year after they are 50 and older, to about 74. And nobody ever questioned that. It was like, you know, that's the gospel. But there are better ways. So mammography downside is there's compression. You press the breasts on the plates. That's microtrauma. That increases risk for cancer cells. You also have the ionizing radiation. That we know radiation increases cancer. So mammography, especially cumulative, year after year, can add to a woman's risk for developing breast cancer. MRI, on the other hand, is a little bit more expensive. It is safer because there's no ionizing radiation. It can tend to overdiagnose because it's more sensitive. Ultrasound is maybe less sensitive, but again, no radiation, very affordable, and that's my go-to, is ultrasound of the breast first as a screening test.
Why isn't that the go-to then? Why aren't we doing more ultrasounds for breast cancer screenings?
Well, that's very interesting. In Europe, I think MRI supersedes mammography. They've embraced it over there. Like I said, it's more expensive. I think it's the system we're in. The allopathic system, system-based medicine, have always put mammograms first, and they're not even questioning it. They're not even critical thinking about the alternatives. They're just, you know, carte blanche, it's mammograms.
Yeah, like you said, one size fits all does not actually fit all, obviously. Very quickly, there's been talk about these turbo cancers. What are they, and what should Americans know when it comes to detection and treatment?
Right, so the term turbo cancer is very controversial. Mainstream medicine doesn't really agree that it's a real term. It's in the folks in my circle, like with the IMA, the Independent Medical Alliance, and we think that there's a correlation, there's a common denominator between turbo cancers and the mRNA vaccines. This term arose on social media and in certain forums and podcasts in 2022. And it's basically a surge in the number of cancers, especially in young men and women, 20 to 40 years old, where cancers were not really seen much until the rollout of the vaccines. And then there was a huge spike in cancers, and that's like the common denominator. Very controversial, and more study needs to be involved. But these are very aggressive stage 4 cancers, usually discovered stage 3, stage 4, which is late in the game, and very detrimental to humanity.
What do you see transforming cancer detection in the next 5 to 10 years?
Well, I think we need to discover more less invasive ways, safer ways to screen. So colonoscopy, for example, has a lot of drawbacks. Anesthesia, bowel perforation. For a screening test, I mean, that's kind of extreme. Cologuard, which is like a stool study, non-invasive, is a good alternative. And I think we have what we call liquid biopsies. So Grail is coming up with something called Gallery, which screens for 50 plus cancers. There are other technologies on the forefront in the pipeline that you're using saliva, breath, and urine and blood tests. So they're non-invasive, they're safer for the patient, and they're just as accurate. And I think with AI coming on board, that's going to accelerate the development of these kind of liquid biopsy tests.
All right, Senior Fellow for the Independent Medical Alliance, Dr. J.P. Saleeby. Thanks for joining us this morning. We appreciate it.
Thank you, Jen.